This video is to demonstrate the use of a fenestrated drape in the COVID-positive or COVID-suspected patient. First, the patient is prepped as per the prior video on ED airway management in COVID-19. Next, in preparation, the fenestrated drape is placed on the patient to be later unrolled. To the right of the operator is the ET tube and 10 cc syringe, and to the left, the laryngoscope. The respiratory therapist and the vent will be to the operator's right as opposed to the left, as is customary in ED intubations. After pre-oxygenation, the patient is given an induction agent and high-dose paralytics for RSI. After the patient is induced and completely paralyzed, the drape is drawn over the patient's face and head. There should be ample material from the drape to protect the operator and the respiratory therapist, and there should be enough material above the patient's face to allow for laryngoscopy. Underneath the drape, the respiratory therapist will hand the operator the ET tube. Notice during this time, the video portion of the laryngoscope is kept away to avoid contamination of the laryngoscope. The respiratory therapist continues to assist with the intubation, removing the stylet with one hand underneath the drape and one hand over the drape, also to reduce contamination. After the stylet is removed, the cuff is inflated. The respiratory therapist will then connect the patient to the vent. Notice the HME filter. Not pictured is the end-tidal CO2 adapter, which should be connected. Notice also that the respiratory therapist continues to use a one hand under and one hand over technique to secure the tube. After this, the respiratory therapist continues to hold and maintain the ET tube in place. The operator removes both hands and begins rolling the drape from underneath in order to avoid spreading any aerosolized materials that might be on the inside surface of the drape. A nurse or assistant would then roll from the other side and the drape would be removed. The nurse or assistant would of course be wearing proper PPE, not demonstrated here in this video. The tube would then be secured in place. Thank you for watching this video. If you have any questions, comments, or suggestions, please let us know.